Today, let's meet Robert Rowe. Robert is 58 and he loves his recliner, spicy wings, and raising his dog to the mailbox. But 3 weeks ago, something strange happened to him. Robert was climbing the stairs and boom, his chest felt tight, like someone parked a small elephant on his chest. And that elephant ordered a pizza and decided to stay for a while. The tightness went away when he sat down, but it kept coming back. Every time Robert walked fast, climbed stairs, or yelled at the TV during football, that elephant showed up again. So Robert did the smart thing and sought our advice and help. I'm Dr. Joseph Gnanaraj, a practicing cardiologist in Waterbury, Connecticut, USA. When I saw Robert, I said, let's run a stress test. That's just a fancy way of saying, let's watch your heart while it works hard. Robert walked on a treadmill while wires watched his heart. The test came back positive. Not positive like winning the lottery. Positive like, yep, something is blocking traffic in your heart. Here's what was happening inside Robert's chest. His heart arteries, which is also called the coronary arteries, are like little garden hoses that carry blood to his heart muscle. Over the years, junk called plaque had been building up inside those hoses, kind of like greases building up in a kitchen pipe after years of frying bacon. The hose was getting narrow. Less blood was squeezing through. When Robert's heart worked hard, it wasn't getting enough blood. That was the elephant. I told Robert, you need an angioplasty and a stent. Robert was puzzled and said, yeah, what now? I said, in patients with stable symptoms, meaning chest pain that comes and goes with activity, a stent may help relieve those symptoms and improve quality of life. However, it has not been shown to prevent heart attacks or extend life in most stable patients. However, in an emergency like heart attack, opening the blocked artery with angioplasty and a stent could be life-saving. Your doctor will explain whether angioplasty is the right choice for your specific situation. I said, don't worry, Robert, here's how it works in plain English. First, we don't cut your chest open. No big scary surgery here. Instead, we go in through the wrist or groin artery using a thin tube like a spaghetti called catheter. They gently guide it through Robert's blood vessels all the way up to his heart. Robert will be awake the whole time, just relaxed, like he's watching a boring movie with really good medicine on board. Once the catheter finds the clogged hose, we slide a tiny balloon and inflate it for a few seconds right at the blockage. The balloon squishes the junk flat against the arterial wall, like stepping on a garden hose to squeeze out a clump of mud. Suddenly, the blood can flow again. This is closely analogous to photography, where we take pictures. The process is called angioplasty, similar to photography, and the picture we take is called angiogram, similar to photograph. But we don't stop there. We leave behind a stent in most cases. A stent is a tiny mesh tube, kind of like scaffolding holding up a tunnel so it doesn't cave in. That stent props the artery open for good. Now, 20 minutes later, after undergoing that procedure, Robert's blocked pipe is open. No more elephant on the chest, no stair problem. Robert's heart gets its blood back. Is the procedure totally risk-free? There can be some bruising where the tube went in, or a small reaction to the contrast dye doctors use to see the artery on the X-ray. Sometimes, very rarely, serious problems like injury to the heart arteries, bleeding around the heart, or stroke can happen. However, the team watches closely the whole time during the procedure, like a lifeguard who never blinks. And the complication rate from the angioplasty and stenting is very, very low. Now, here's the part Robert needs to remember. That stent is not a magic cure. It fixed one spot. Robert still has to take his medications every single day, especially 2 special pills that stop clots from forming on the new stent. He needs to eat better, walk more, sleep better, and reduce his stress. Because the stent bought Robert time, what Robert does next is what keeps that elephant away for good. So, if you ever felt that tight, squeezy elephant on your chest feeling, don't be a hero. Don't Google it for 3 hours. Call the ambulance right away. Robert did seek help, and now he's back to raising his dog to the mailbox, just a little slower and a lot smarter. If you like the information on this video, please subscribe to DrLogic360 and share it with your friends and family. Thanks for joining me, and this is Dr. Joseph Gnanaraj signing off.